I like to imagine that the purpose of the body is to carry your brain around. Think of what activities you're doing in a day. You're basically doing them to feed and protect your brain, period. Think of nightstick fracture, for example. You find it better to break the bones of the forearm than let an object hitting the brain, because that's what you care for. That's what you've been caring since morning. So since we wake up today, all what you've been doing is to take care of brain by feeding and protecting. Now, given the delicate nature of the brain, it has got highest level of protection, and a part of this protection is made of a layer of membrane which is called the meninges, and that is the topic of discussion today. What's up, ladies and gentlemen? Welcome back to Neurosketch with Dr. Kenny. But if this is the first time you see this channel, don't forget to subscribe. The topic of discussion today is meninges. Alright, folks, time to dive deep. But before we dive into details of the meninges, let's see other levels of protection of the brain. The brain has got highest level of protection, and this protection starts from outside by this layer which is called the scalp. We'll have a separate discussion on the scalp, but we've already discussed about the skull, the bony framework that protects the brain. And then deep to the skull we have membranes which are called the meninges. This meninges is a topic of discussion today, and we also have the fluid which is circulating between different layers of these meninges, and the function of this fluid is to it has physical and chemical protection. Physical to provide the buoyancy of the brain, but chemical by making suitable chemical environment for brain activities. We're going to discuss about this cerebrospinal fluid at some point, and that's a separate discussion. Now, the meninges is a plural of word meninx. The singular is meninx, and the word meninx means membrane. So these meninges are the membranes that are covering the central nervous system. Remember, the central nervous system is made up of brain and the spinal cord. Now, the meninges that are covering the cranial part of the central nervous system, which is the brain, are called the cranial meninges, and the meninges that are covering the spinal cord are called the spinal meninges. What are they? From superficial to deep, we have the dura mater. This outermost one is called the dura mater, and the intermediate one is called the arachnoid mater, and the deep one, the deepest one, which is close to the brain, is called the pia mater. The pia mater. You might have had different pronunciation here, so it's a mater with a single T and not matter with double T. Remember, matter is anything that has got mass and can occupy space, but mater is a Latin word for mother. Now, these membranes are called mother because they are mothered in the brain. They are nurtured in the brain. They are taking care of the brain in a similar fashion as how uterus was taking care of you when you were in your mother's womb, and they are representing womb. Now people would use this pronunciation interchangeably, mater and matter, and it's okay, and we're going to choose either of them for simplicity, just for convenience, and deep down they have different meaning. The word dura means hard and mater means mother. Now the dura mater is hard mother, and it's called hard mother because it's giving physical protection of the baby, and our baby today is the brain. And on the other hand, the pia mater is translating to tender mother, meaning that it gives tender love care. And what are these? These are things like feeding the brain, exchange of waste products are done by the pia mater. And then the dura mater or the dura mater is also called the patch meninges. The word patch means thick and the meninges means membrane. Now the patch meninges means the thick membrane, and together the arachnoid mater and the pia mater, they are making the leptomeninges. Lepto means thin and the meninges means meninges, like membrane. So we have the thick membrane, which is called the patch meninges, which is hard matter, which is the dura mater, and we also have the thin meninges, which is the leptomeninges, which is made up of arachnoid mater and the pia mater. Now, starting with the outermost one, the dura mater. This is the dura mater, and the word dura means hard, mater means mother. Now, it's also called the patch meninges. Patch means thick, meninges means membrane, and this is the outermost covering of the brain, and it is composed of the dense connective tissue. This connective tissue is hard dura mater, and the dura mater has got two layers. The outermost layer of the dura mater is called the periosteal layer. The periosteal layer is peri means around, osteo means bone. So this membrane is adhering to the bones of the cranial cavity, and that's gonna be your the periosteal layer of the dura mater, and then the other layer of the dura mater is called the meningeal layer, because this layer is close to the other meninges, the arachnoid and the pia meninges. This meningeal layer, so it has good two layers, and we're going to see later that these two layers are fused with one another, but at times the meningeal layer of the dura mater is splitting away from the periosteal layer of the dura mater to form some spaces and reflections. We are going to see them really soon. Next is the arachnoid matter. Guys, remind me again, what was the name of the class to which the spider was belonging? The spider is belonging to class Arachnida. Perfect. Now, the arachnoid is named after the spider-like appearance. It has got the spider-like appearance, the web-like appearance, and it's called the Arachnida. Now, Arachnida is a vascular, and this is exam tip. You might be asking your exam in multiple choice, which of the following is a vascular? That's going to be your arachnoid, the arachnoid matter. But we see also deep to arachnoid matter, we have a space to which the cerebrospinal fluid is circulating. Don't worry, we're going to talk about it shortly. And next is going to be your pia mater, and the pia mater means the tender mother, because this layer of meninges is providing nutrition to the brain. Now, the pia mater is very thin and delicate, and it's highly vascularized to make sure that it supplies the nutrition to the brain. Highly vascularized, and it's very thin. And most important is the pia mater, it goes with the convolutions of the brain. Remember, the brain has got infolding, the convolution, and the pia mater is going deep with the brain. It goes up with the brain, so it doesn't leave the brain. Whenever brain goes deep, it also goes deep. And this is to say it's very hard to separate. It's very hard for you to peel off the pia mater from the brain without injuring the brain tissue. This one is very adherent to the brain, and it's hard for you to separate from the brain without injuring the brain tissue. It also covers the proximal, the initial parts of the each blood vessel that is penetrating to the brain. So whenever blood vessels want to go to the brain, the proximal part, the initial part of that blood vessel is being covered by the pia mater, and that's your deepest tender loving mother. Now, we have said we have two layers of the dura, the periosteal layer and the meningeal layer. The periosteal layer is close to the bone, and the meningeal layer is close to the other meninges. Two layers of the dura mater, they are fused, except to some point, and the meningeal layer of the dura mater is reflecting away from the periosteal layer, creating a space, and this space we have said is called the venous sinuses. They are called the venous sinuses or durovenous sinuses. We have a separate discussion discussing about the durovenous sinuses, but also the meningeal layer of this side and the meningeal layer of this side of the dura mater, they meet at some point, and then they are descending deep to the cranial cavity to compartmentalize the cranial cavity, and these are the ones that are called the dural refractions. The dural refractions are also called the dural infoldings, and they are formed by the two face-to-face membrane of the face-to-face meningeal layers of the dura mater, as they are going deep to the cranial cavity to compartmentalize the cranial cavity into different compartments. Guys, remember, we had the cranial cavity, which is a space within the cranium, right? And it's a hollow space. Now, the cranial cavity is being compartmentalized, being kept in different compartments by the dural refractions, and we know the dural refractions are formed by which layer? The meningeal layer of the dura mater into different compartment. The internal meningeal layer of the dura mater is sustentacular, meaning it is supporting there, as you can see, compartmentalize the cranial cavity into different compartments. But this compartment, they are partial compartment. I repeat again, this compartment, they are partial compartment, meaning that you have communication between, they are not like really closely on either side. No, we have a communication between different chambers of the cranial cavity, and these chambers have been brought by what? By the dural refractions or the dural infoldings. Now, these are the refractions. We have the Falx cerebri, the biggest one. The second biggest is the Tentorium cerebelli, and then we have the Falx cerebri, and lastly we have the diaphragmatic cella. We're going to discuss each one in turn, starting with Falx cerebri, the Tentorium cerebelli. I am deliberately starting with Tentorium cerebelli because it is so important. I'm going to mention shortly. Now, the word tentorium comes from tent, and the function of tent is to cover. But what does it cover? It covers the cerebellum. So you can guess from the word tentorium cerebelli, it's a tent of the cerebellum. It covers the cerebellum. This is the tentorium cerebelli, and this is the cerebellum covered by the tentorium cerebelli, and this is the tentorium cerebelli in different pictures. Superior view, this is the tentorium cerebelli, and this is also tentorium cerebelli. I'm giving you 3-dimension geometry of the tentorium cerebelli. Okay, the tentorium cerebelli is U-shaped, because the space which is left here it resembles letter U, and it's a U-shaped. One more time, we have said these dural reflections, they compartmentalize the cranial cavity, but they are forming partial compartment. They are not covering completely. They are leaving gaps for communication between different parts of the brain, Now, the tentorium cerebelli is very important, and I've started with it because it divides the cranial cavity into 2 important compartments. The tentorium cerebelli, it divides the cranial cavity in 2 important compartments, and the first one is below the tentorium cerebelli, and it is called the infratentorial compartment. Infratentorial compartment below the tent, and the supratentorial compartment above the tentorium cerebelli. We have two main compartments which are brought by the tentorium cerebelli, and we have the infratentorial compartment and the supratentorial compartment. Now, in the infratentorial compartment sits the cerebellum and a part of the brainstem. Brainstem and the cerebellum are found in the infratentorial compartment, and the supratentorial compartment is major occupied by the cerebral hemispheres. Cerebral hemisphere, and this is the tentorium cerebelli. Why is it why are we discussing about these compartments of the cranial cavity? It's so important because later we're going to discuss about the brain herniation syndrome. We see that parts of the brain can herniate from one compartment to another, and you won't be able to describe this herniation if you don't know the compartment, if you don't know where are the landmarks of the compartment, and this is also important. Now, 3-dimension geometry again of the tentorium cerebelli. This is tentorium cerebelli. This tentorium cerebelli has got a space here which is a U-shaped. This is space which is left is U-shaped, and this space is called the tentorial notch. So, the tentorium cerebelli covers demarcate 2 compartments, but the 2 compartments, the infratentorial and the supratentorial compartment, they are communicating through this notch, through this hole which is left here, and this notch is called tentorial notch, or the incisular notch. Incisular tentori, or tentorial notch, they all refer to the same thing, which is this space which is left between which is left by the tentorium cerebelli for communication, and here is where the brainstem passes. The brainstem passes in tentorial notch to go to the posterior cranial fossa. Guys, one more time. The tentorium cerebelli, I haven't mentioned, I'm mentioning now. The tentorium cerebelli covers the posterior cranial fossa. It covers the posterior cranial fossa. Okay, that's the tentorial cerebelli, but again, it's a partial partition. Now, what are the attachment of the tentorium cerebelli? Tentorium cerebelli attaches anteriorly from the anterior cranial processes. These are the anterior cranial processes. It goes to the posterior cranial processes, and then it attaches on the petrous ridge of the petrous part of the temporal bone. It goes to attach part of the parietal bone, and then it attaches the transverse sinuses, groove for transverse sinuses. And then it goes posterior to the internal occipital protuberance and goes on the other side. These are the attachment of the tentorium cerebelli. It's very, very important, and you can see once it attaches here, it covers the posterior cranial fossa. It covers the posterior cranial fossa. It forms like a roof. It forms like one more time. It forms like a roof of the posterior cranial fossa. The roof of this is why the tentorium cerebelli is very, very important to note. Next gonna be your Falx cerebri, and the word Falx means a sickle shaped, and you can see the free margin. This is a Falx cerebri, and you can see the free margin. The first cerebri is a sickle shaped. That's got the shape of the sickle. That's the tentorium, that is the falx cerebri, and this is a sagittal view. On coronal view, coronal section, if you transect the brain in this fashion, you will see this is the falx cerebri. Falx cerebri. Now, falx cerebri divides the supratentorial compartment into two compartments. Remember, we have the tentorium cerebelli, which is dividing cranial cavity into the infratentorial compartment and the supratentorial compartment. Now, the supratentorial compartment is further subdivided by the falx cerebri into the left and right, and here is where the different hemispheres of the brain are sitting. Now, the right cerebral hemisphere is sitting in the right compartment of in the right compartment, and the left cerebral hemisphere is sitting on the other side, on the left hemisphere. In between, we have a dural reflection, which is called the falx cerebri. Falx cerebri. Now, the falx cerebri enters in this longitudinal cerebral fissure. So we have a fissure here, a fissure between the two cerebral hemisphere. We have right cerebral hemisphere and left cerebral hemisphere. In between, we have a fissure which is separating this cerebral hemisphere, and it's called longitudinal fissure. And there's where your falx cerebri will enter. That's where your falx cerebri will enter. And posteriorly we see the falx cerebri will meet the tentorium cerebelli here. The falx cerebri will meet tentorium cerebelli. So what are the attachment of the falx cerebri? Anteriorly, it attaches to this process here, which is called the crista galli of the ethmoid bone, and it goes posteriorly to attach to the internal occipital protuberance. But in between here, it attaches this midline, the median plane on the inner surface of the calvarium. We will discuss about this one, and we say this is a groove for it's a groove for superior sagittal sinus, but also the superior sagittal sinus is within the dural reflections, and that's gonna be your falx cerebri. One more time, this is the coronal view of the CT scan showing different compartments of the cranial cavity. We have said the tentorium cerebelli is going to divide the cranial cavity into infratentorial compartment and the supratentorial compartment, and the supratentorial compartment will be further subdivided by the falx cerebri into left and right halves, which are occupied by cerebral hemispheres. Next gonna be your falx cerebelli. Falx cerebelli is very small, but the word falx also means sickle shaped, so it has a shape of sickle, but it's very small. It's found in the infratentorial compartment. And what the function of it again? It is like to separate, to partially separate the two cerebellar hemisphere. The falx cerebri separated two cerebral hemisphere. The falx cerebelli separated two cerebellar hemisphere. Lastly, gonna be your diaphragmatic cellar. Diaphragm means partition. Cellar means cella tussica. So this is the dural reflection that is covered in the cella tussica to compartmentalize the cella tussica to keep it away from the rest of the cranial cavity. Remember what sits in the hypophyseal fossa. Remember your cella tussica, we discussed about it. Cella tussica, dorsum cellae, tuberculum cellae, and hypophyseal fossa. And what sits in the hypophyseal fossa again is pituitary gland. Now the pituitary gland sits in the hypophyseal fossa, and then it's covered on top by a membrane which is called the diaphragmatic cellar. But one more time, this is just a partial partition, does not cover completely to allow communication of pituitary with the rest of the brain. See, this is a pituitary, but it has got a stalk, a stalk which brings like vessels, arteries and veins that are connecting with the pituitary to make sure that then everything is coordinated. And this is to say that the diaphragmatic cellar or the diaphragma cellar is forming the roof of the cella tussica, or the roof of hypophyseal fossa. And what sits on hypophyseal fossa, that's always gonna be your pituitary gland. Now, what's the clinical significance of these reflections? We have said we're discussing these reflections because at some point we're going to discuss about the brain herniation. We see a certain part of the brain is protruding into different compartment which is not supposed to be. We're going to discuss about the brain herniation syndrome, and you will keep track. You find the link downward and you keep track of it. Next, let's discuss the spaces between the meninges. We have said we have three layers of the meninges. We have the dura mater, the arachnoid mater, and the pia mater. And between these meninges, we have spaces, and we've grouped these spaces into real spaces and the potential spaces. Real spaces, these are the natural spaces. They should be there. But potential spaces, these are not natural spaces. They only become space potentially when you have a certain pathology, and these are not natural space. So out of the spaces that you have, the subarachnoid space is considered as a natural space, as a lead space. It should be there. But epidural space and subdural space, these are potential space. They only become space potential. They should not be there unless we have a pathology. So they become spaces when you have a condition, we have pathology, and this is why they are called the potential spaces. Now let's discuss each one in turn, starting with the epidural space. Now the word epi means above, dural means dura. This is a space above the dura mater here, above the dura mater. Of the space, we don't have the space, but the potential space which can arise between the dura mater and the bone. Remember, the outermost layer of the dura mater is called the periosteal layer, which is adhered into the bone, and this is why you do not expect to have a space here. But due to certain pathologies, for example, bleeding from certain arteries can result into epidural hematoma, creating a space, forcing a space between the dura mater and the bone, which is called the epidural space. So you can agree with me that epidural space is only pathological space. It's a potential space which becomes space only when you have pathology, and it's not a natural space. Next gonna be the subdural, and the subdural means below the jula. Below the jula, this is subdural space. The subdural space is between the inner layer of the dura mater and the arachnoid mater. The inner layer of the dura mater and arachnoid mater here. This is a space, and this is space. It is not a natural space. It is a potential space. It only becomes a space potentially when you have a certain pathology, for example, subdural hematoma. Now, very important to note is that you have veins which are traveling through this subdural space, and these veins are called the bridging veins. We're going to talk a lot of this about these veins when we're doing when we're discussing about the subdural hematoma. We have a separate discussion discussing about this intracranial hemorrhage, epidural, subdural, and subarachnoid hematoma, and we find this discussion in the later video. So what goes through subdural space? Bridging veins. Yes, you should always remember that your bridging veins are passing through the subdural space, and they are very important. Okay, they are passing also through the subarachnoid space, but they are very important in subdural space, as we are going to discuss in the later discussion. Next is going to be your subarachnoid space, and the subarachnoid space is the space below the arachnoid mater. The space below the arachnoid mater is called the subarachnoid space. This is a space, but this space is actually between the arachnoid mater and the pia mater here. This is a real space. I'm repeating again. This is a real space. It is a natural space, and it should be there. A normal adult brain should have this subarachnoid space. And what goes through the subarachnoid space is gonna be your cerebrospinal fluid. The cerebrospinal fluid is circulating in the subarachnoid space. Is circulating in the subarachnoid space, but also have arteries. Also have major arteries in the subarachnoid space. Remember, major arteries are in subarachnoid space, not in the arachnoid mater. We have said the arachnoid mater is avascular, has got no vessels, but the subarachnoid space has got vessels which are wandering around. Okay. Now the cerebrospinal fluid is circulating in the subarachnoid space will later going to be drained into this superior sagittal sinus by the way of these structures. These structures are called the arachnoid granulations. They are special for emptying the cerebrospinal fluid into the venous blood for returning for circulation. Yeah, those were the meninges. Those are the spaces between the meninges. Now we have said we have meninges, and the meninges are covered in the central nervous system. Meninges means membrane, and they are covered in the central nervous system. But the central nervous system will have brain and spinal cord. The cranial part of the central nervous system is made of brain. Now the membranes that are covered in the cranial part of the central nervous system are considered as cranial meninges, yes, and the membranes that are covered in the spinal cord are called spinal meninges. Now, what are the difference between the cranial meninges and the spinal meninges? Well, generally, we do not have difference. They are almost continuous. The meninges that are covered in the brain, they are almost continuous to the meninges that are covered in the spinal cord, except that in the spinal cord, the epidural space is full of fat. We have a fat in the epidural space which is called the epidural fat. Like, it is not in contact with the bones, as we've seen in the cranial cavity. That we've seen that the layer of the dura mater is adhering to the bones, and that is different in the spinal meninges. All right, folks, this is what I had for you, and this sounds like pretty much it. And don't forget to subscribe, and if you like this discussion, share to your friends, and don't forget to follow the next discussion about the intracranial hemorrhage, and see you very soon.